Let's go now, Anita, to the causes of diabetes. Some of you have already covered. Let's see what we have here. So you've already told about a little bit about autoimmune.
Yes.
You've told about injury to pancreas in type 2.
Yes. So because of the stress, because the constant requirement for glucose and there's a constant requirement for the insulin to work over time just to keep the see all hormones. It's like this, it's like a tug of war. All hormones are working to get the sugar levels pumping into your blood, and this insulin, one man army kind of a thing, now trying to control the effect of all the other hormones by reducing the sugar levels.
Pancreas starts getting injured or deteriorated slowly.
Yes.
Yeah. And then the physical and mental stress, you have mentioned already a little bit about it, and the poor lifestyle habits.
Yes.
Which is a big cause for it, from especially the modern people, and the choices of the lifestyle which we are trying to help people develop, because rest of the things automatically will change once our lifestyle changes. And also you've mentioned about excessive steroids, which creates a lot of changes. Like you told there are so many medicines you have been eating for the last 30 years and plus, which has a negative impact on your body. And there are certain medications which has a very, very negative effect. Would you like to a little bit describe about those?
Yeah, so medications, this especially applies to people who have chronic conditions like fibromyalgia, where they are subjected to high doses of painkillers, or some cancer treatments where in addition to the chemotherapy, they are given all the hormonal therapies. And then especially for ladies, when they have the PCOD, they are given the hormone supplements to normalize their menstruation. All these conditions where there is an excessive use of artificial hormones, or there is an excessive use of steroids, like people who get autoimmune diseases, other autoimmune diseases, or who have these, and these days allergies are such a common scenario, because we are confusing the immune system with all our chaotic lifestyle, I would like to say, like too much of hygiene. Then there is we work from the night shifts, or sleeping late in the night. All these causes, we need to have that healthy, basically follow the nature. When nighttime sleep, daytime do your work, but these days we do it the other way around. So this, what happens, the hormones are again confused now. They are programmed to work in the light, and certain hormones work in the night. And there's a confusion. So many people now have a lot of allergies, right from allergic rhinitis to skin rashes, eczema, psoriasis. So sometimes for all these conditions, the doctors prescribe steroids, especially for severe psoriasis and all. You need to take the steroids. It definitely takes a toll on the body.
Of course, because we are not trying to improve what is the root cause, but giving more chemicals to the body, which again the body has another level of fight to do other than the disease we are already suffering. Let's go on to the next part and let's understand what do we have more. So we have covered the causes of diabetes. Let's go to the next. We have got symptoms now. अब हम कोशिश करते हैं थोड़ा सा symptoms के in detail में जाने का, and we've got a lot of symptoms here. So some of the symptoms of diabetes are excessive hunger, thirst, excess weight gain, or weight loss. Both can happen. Poor digestion is one of the big issues. Then poor appetite is also a big issue, and excessive appetite. So a little bit, let's talk on these subjects, because of diabetes, people gain a lot of weight, or obesity comes out. So how is this appetite related to the diabetes part?
Again, our body gives us that appetite, the hunger signal, when it requires the fuel, as I said, for carrying out. Now, what happens is the fuel is the glucose, and our lifestyle conditions are such that we are constantly eating excessively, or we are constantly on the move. There's a poor eating habit. Again, I would like to use the word here, the wrong food combinations, and the processed, highly processed food. So all this, what is going to happen is the body is not going to digest the food. Very simple. And if you look at diabetes, it's just that, the body is not able to digest the food. So what happens when the body is not able to carry out the digestion? You don't get the fuel, the glucose. So
So
again,
basically,
even
body
if
is
you
not able
eat,
to break it out, right? The body is not able to break it out and decompose into the right energy form, which is glucose, and absorb that energy. So it's getting undigested and getting stored in form of fat in your body, right? And then what about people who are not gaining weight then?
the people who are not gaining weight, it would be because the fat is also utilized in some people when the condition is very severe. Now, this happens only in very severe conditions. In the early stages, you will only gain weight. But in the later stages, let's say you are ignoring your symptoms, you have excessive hunger, you are eating well, and you are eating all processed food in the process. And then suddenly, what happens? The body now starts reacting. Okay, I'm not getting good quality glucose. So let me start using up all the reserves of the body, all the fats. So
Yeah.
the body uses, it converts fat into glucose. So you start losing weight. Again, this is better explained in acupressure, acupuncture terminology, because when the liver is not able to, there we give importance to not just pancreas, but we give importance to the role of liver and the spleen. So when the liver and spleen are not able to carry out, or the energy supply, when we talk about the energy meridians, when the energy meridians are not able to keep up with the traumas and the stresses of the body, they become blocked, stagnant. This is energy stagnation. So what happens is you start losing weight when the spleen is not able to control. Spleen plays a very important role in acupuncture for digestion, whereas we don't give importance to it in modern medicine. So this explanation is better explained in traditional medicine actually.
Yeah. So let's go, and then we have dry itching and fungal infections also happen. So these are some of the symptoms which can happen, and a lot of people complain about legs. There's numbness in the legs or numbness in various organs. Let's talk a little bit about that also.
Yeah. So this dry itching, the fungal infections, and again the numbness, everything, we can all put it as like the presence of high glucose levels in the blood. So what happens when the glucose levels are high? It's now going to start reacting with the body parts. How is it going to react? The first place where the excessive glucose is going to damage are your blood cells, because the blood is the one which is transporting the glucose from the place of digestion, from your abdominal cavity to different parts of the body. Now, when there is going to be excessive sugars in the blood, so it's obviously going to start reacting with the cells. It reacts with the RBCs because of the presence of hemoglobin. Now, hemoglobin is the one which carries this glucose to different parts of the body. So because it can bind to it, but when there's going to be excess, so what's going to happen? It's going to start reacting inversely. So instead of doing beneficial effect, now the cells are going to start becoming damaged. So RBCs start becoming damaged. That's the first symptoms the cellular changes you notice. So that's why doctors do this HbA1c test, where you measure the glycosylated hemoglobin levels to monitor your 3 months control. Why 3 months control? Because RBC's lifespan in our body is for 3 months. After that, they are destroyed.
Yeah.
So the first place is where the blood cells are damaged. Now, when the blood cells are going to be damaged, now it's going to start again going to have a rippling effect on the body. There's not going to be a proper circulation, because when there's going to be high glucose, the blood viscosity changes, density changes, and so there's going to be a lack of circulation to the essential parts, and especially our legs. Our legs are the ones which are like, the weight bearing part of the body. So all the weight is going there, where circulation is maximum required there also. Because once the blood goes down to the leg, it has to pump up the blood, which requires a lot of energy. And this blood chemistry is changed.
Yeah.
There's going to be a stagnation of blood. And remember, the blood quality is not good. So when the quality is not good, it's going to stagnate there and start deteriorating there. So that's where you get it starts initially as numbness, tingling, which if you ignore, can lead to the occurrence of something called as diabetic ulcers. Diabetic ulcers are nothing because there's increased blood, poor quality blood with high blood sugar levels. It becomes very easy for bacteria to, in the smallest wound, a smallest opening, a smallest insect bite also can trigger the bacterial infection to enter the body, and since the condition is favorable for the microorganisms to grow easily, they start growing there, causing diabetic ulcer and eventually gangrene where the cells die completely.
Yeah. So basically, it's lack of circulation of energy and the blood, and with blood there's oxygen, so lack of oxygen flow in that organ also.
Yes.
Because in yoga and meditations, we are ensuring that there's sufficient amount of oxygen, sufficient amount of cosmic energy, the prana flowing into these organs, and magically, in our community, I've seen so many people getting cured of diabetes and all of these problems associated, and people wonder. And this is the video we are trying to explain the science behind it, how our ancient therapies are so well designed and they are so powerful to cure the incurables, basically, because diabetes is something incurable in the medical terminology. But if we have the right patients and if we are doing the right practices, we can create the right circulation of energy in our body, and that circulation of energy ensures, purification of blood and right transportation of blood to different organs at different levels. And cardiovascular is very, very important for circulation of blood. So exactly. Even in diabetes, there are so many things like we do in yoga therapy, a lot of postures where we try to bring our head down, below the heart level. The moment head comes below the heart level, like when we do forward bending and all, we're ensuring that the blood circulation is happening to and fro in whole of the body organs. There's so many leg movements. Sometimes we raise the leg up, upward raising of the leg, like in Sarvangasana, where we are ensuring the blood is naturally flowing down. So what you are saying exactly we are doing in yoga therapy also. And we'll talk more about this. Let's go to the next part and see what next do we have in the slide. So we have already covered now the symptoms also, and a lot of people can resonate. There are many, many more symptoms. We have just highlighted a few here. Let's go to the next fourth one. We have got complications due to diabetes now.